It's something that a lot of women deal with, but many women don't want to talk about it. But you don't have to suffer in silence. There's actually help. And joining me to talk all about it and more, including all of those solutions, is Dr. Alejandro Treszezamsky. Good morning.
Good morning. How are you doing?
I am doing so well. I'm looking forward to talking with you about some of these things that women don't really want to talk about, starting with female pelvic medicine and reconstructive surgery. And who should see a specialist like you?
Right. So the name of the specialty is urogynecology and pelvic reconstructive surgery. It's a subset or a subspecialty within OBGYN or urology.
Oh, okay.
So a small number of OBGYNs specialize into urogynecology, a small number of urologists specialize into female urology or urogynecology.
Okay.
So it's a subspecialty that bridges issues between gynecology and urology. And you mentioned some of them very well. Urine incontinence is one of them, pelvic pain, pelvic organ prolapse, which is when the organs of the pelvis, due to lack of support, start descending gradually over time.
What are some common symptoms that women might notice that could signal a pelvic floor issue?
Probably the most common one is urine incontinence. That is when people lose the control of the urine. The urine comes out in moments when we don't want it.
Right.
That is very common.
Okay.
In women, the problem tends to start after childbearing.
Okay. If they are experiencing those symptoms, there is hope for a better outcome where they won't experience that anymore?
Sure. I want to clarify that, although I do lots of surgeries, not everything is surgery in my field. We start with a very thorough evaluation. Sometimes it needs extra testing, sometimes it doesn't. And then my idea is to give the patients first an understanding of what's happening.
Right.
Sometimes the pelvic floor problems are different but come in combination.
Yeah.
For example, they could have incontinence and prolapse, but there are non-surgical treatments, including exercises, diet modifications, medications, and for certain conditions, there are surgical alternatives that we obviously discuss and some women undergo.
But why is it important for them to speak up about this and to seek professional help?
As I said before, in general, these problems are not dangerous. But they are increasingly bothersome to the extent that some women limit social interactions because they're afraid of losing control at the wrong moment. So some people get anxious, get very depressed because of this before they look for a solution. So in that sense, it's very important. Occasionally, the problems can bring other more dangerous problem, increasing the risk of bladder or kidney infections or retention of urine.
To schedule an appointment, call 210-402-3700 or visit our website, southtexasurogyn.com. Again, that's southtexasurogyn.com.